Okay, so we are going to talk about AEDs right now. AEDs are awesome. So first off, know an AED is also called a defibrillator. So if you ever hear someone say like we need to defibrillate them, an AED is a defibrillator. It's an external defibrillator. So an automatic external defibrillator, what AED stands for. Now, a couple things is people kind of get scared of AEDs and they feel like they're intimidating, but they are so simple. So I'm going to show you a couple things that all AEDs have. So first off, when you open up an AED, most of them will have instructions inside that say, 1, turn it on. Number 2, follow the promptings. Number 3, shock and press the shock button if it tells you to press the shock button. Also, when you look at the defibrillator, it will have the same. It'll have number 1, turn it on. Number 2, follow the promptings. Number 3, press this shock button if the machine decides it's a shockable rhythm. So your papers you have with ventricular fibrillation, now that is the rhythm that this is going to identify as a shockable rhythm. And that's an important rhythm for you guys to know. So if you ever see that, if you're ever taking care of a patient, or if you're ever in a room, someone passes out, you see them on the monitor, if you see that rhythm, that is ventricular fibrillation. That's usually the first dead rhythm that someone has. That sounds kind of weird. But when somebody's heart first stops, it's not like in the movies where it's going along, then it flatlines. It usually goes to that ventricular fibrillation. That rhythm is the best rhythm to bring somebody back when they're in that, if we can shock them quickly. So when you see that ventricular fibrillation, we need to right away start our chest compressions. Start compressing, circulating that blood and oxygen to keep things alive. When we stop, whenever we're not doing CPR, their survival rate, like the percentage of them, the chance of them surviving, drops and drops and drops. So it is important, as soon as we can, start chest compressions, send somebody to get the AED, and as soon as we get the AED, let's turn it on and it will walk us through. It tells us everything to do. So turn it on, follow the promptings. If it says it's a shockable rhythm, press the shock button. Now, sometimes we'll put the AED on and it won't be a shockable rhythm. It will say no shock advised. If that's the case, they still could be dead. It could just be more that asystole or a rhythm that's not shockable. So if the AED says no shock advised, if needed, continue CPR, it means you need to check for a pulse. Feel for a pulse. If you feel one, you're like, oh, there's a pulse, yay, you brought them back. You still need to stabilize them, make sure they're okay, and send them to the hospital, send them to the ER. They still need help. But it is important to make sure, if it's not shockable, see if there's a pulse. If you don't feel a pulse, they're still dead. They still need CPR. They still need help. But shocking them, the defibrillator is not going to help. But we still need to get on the chest and do our CPR like we learned in our last video and as we practiced. We need to do that good, effective CPR until our AED says it's time for a rhythm check again. So you'll still leave this on. That beeping, it will give you like a little click to do your beat to. And you'll leave this on. It will count down 2 minutes and it will tell you when it's time to check that rhythm again.